France on 30th May.
Congratulations are in order. Back to news-making headlines. In nearly 26 counties across Kenya, childbirth still comes with the fear of death for both mother and baby. Tana River County is among the hardest hit. But after years of silence, an operating theatre at Bura Sub-County Hospital is back to life, offering new hope in the fight against maternal and newborn deaths. Eunice Omolo reports.
For years, mothers in Tana River County facing childbirth complications have lived with one painful reality. The moment labor turns critical, survival often becomes a race against distance, a desperate journey across rough roads, delayed referrals, hours slipping away between life and death, and sometimes tragedy.
Most causes of maternal mortality is postpartum bleeding after childbirth. The second most common, which raises the maternal mortality rate, is hypertension in pregnancy. But we have other causes. Infections plays a major role also as number 3. We could have also abortions.
But on one humid Thursday evening inside Bura Sub-County Hospital, something extraordinary happened. And behind the doors of forgotten operating theatre that had remained silent for years, machines flickered back to life. And once again, after a long time, doctors and nurses moved with urgencies. And with it, hope returned to Bura Sub-County Hospital. At exactly 5:45 p.m., an inter-county maternal and perinatal death surveillance and response team, MPDSR, huddled outside an operating theatre that has remained silent for years.
Sterilization machine haifanyi. Sterilization machine. Na engineer amesema atafix. So hii theatre imefungwa kwa sababu ya 60,000, kwa sababu ya machine ambayo inaweza kuwa repaired.
Doctors, nurses, theatre technologists, neonatal specialists, all preparing for historic moment.
Is at 35 point.
The anesthesia machine has been checked repeatedly, and finally, the oxygen lines are working. For the first time in years, this theatre is about to host a cesarean section.
We identified Bura being as one of the sub-counties with one of the highest burden of maternal deaths.
Any concern from there?
Amina Musa has been in labor that has stretched into a third painful day, and every sound behind the theatre doors forces him to pause and pray. Doctors monitor contractions, check the baby's heartbeat, and attempt medical intervention, but labor fails to progress. Doctors now fear the baby cannot safely pass through the birth canal.
A traditional birth attendant who was gracious enough to bring this mother to the hospital, and we thank her for that. But reached a point when we felt it was taking too long and the baby was showing signs that the baby may not be able to come out safely. In our language, we call it cephalopelvic disproportion.
Cephalopelvic disproportion, CPD, a condition where the baby's head is too large to safely pass through the mother's pelvis.
What would have happened? The baby would have actually ended up becoming worse, in distress, and probably may not have come out.
For years, mothers facing obstetric emergencies in Tana River County were referred to Hola Referral Hospital or Garissa or Kilifi counties.
Garissa now is actually top in the list and followed by you, but you are number 2 because you are referring all your cases to Garissa Sub-County Referral, Garissa PGH.
Structurally, the theatre existed. It had been equipped years ago under the Managed Equipment Service Program. But the infrastructure, the unit remained largely unused for over 6 years. Challenges ranged from staff shortages and lack of running water to equipment maintenance problems. Eventually, the theatre became unsafe after years of inactivity.
As of today, it feels so good that we have achieved the processes of utilizing our theatre here in Bura, that we will be able to support and help our communities, especially mamas who come with complications on delivery.
One missing component paralyzed the entire unit, an oxygen regulator. Every hour, every day, every year, babies are lost. One of the most major causes of death among children is asphyxia, that is, lack of oxygen during delivery or immediately after delivery. You see behind me here, the medical gas manifold room is one of the most critical units in the hospital as it transfers oxygen into delivery rooms and also in neonatal hospitals. Therefore, mothers' and babies' lives are saved. However, if this critical unit is not well maintained, it's not well prepared, it's not well funded, we risk losing more lives than saving them. Hours before surgery, an oxygen regulator is sourced from Garissa Referral Hospital. Technicians reconnect oxygen lines. Days before the historic surgery, a coordinated rescue mission had already begun. The Inter-County MPDSR initiative brings together medics from counties including Nairobi, Garissa, Kiambu, Bungoma, Kilifi, Kajiado, and Nyeri counties.
In a day in this country, we are losing 15 mothers every day. In a day in this country, we are losing 92 newborns. Some of these are very preventable. Our figures are unacceptably high. Our MMR as a country is very high. So we just want to see what we can be able to do and change strategies that can change into strategies that can be able to work for us.
According to the Kenya Demographic and Health Survey, Kenya's maternal mortality ratio stands at 355 deaths per 100,000 live births, while neonatal mortality stands at 21 deaths per 1,000 live births. In Tana River County, only 59% of births are attended by skilled health workers compared to the national average of 89%, highlighting the urgent need to strengthen maternal and newborn healthcare services in the region.
We've created a dashboard where a governor can be able to access quickly and see what is happening in his county in terms of maternal and perinatal death.
Nearby, another team races against time inside the newborn unit. Beds are assembled, floors disinfected, and oxygen floor tested repeatedly. Back inside the theater, every second matters. Leading the surgery are consultant obstetrician gynecologist Dr. James Amenge and Dr. Amina Mohammed.
So our hope is that in this country one day we are going to have 0 MMR and 0 perinatal death.
During a CS section, surgeons make an incision through the abdomen and uterus. Then, suddenly,
the next essential new
a cry pierces through the theater. At around 7:30 p.m., a baby boy is delivered safely.
Nina shukrani kubwa sana kwa Mungu kwanza kunitolea kijana kwa mara ya kwanza akiwa mzima na akiwa salama sana. Mimi ingenifanya nikarimu sana. Ilikuwa inisababisha mimi niende Garissa ama sehemu zingine tofauti ambayo ingekuwa ni gharama juu yangu.
For Tana River County, this moment represents far more than one successful surgery. The county spans nearly 38,000 square kilometers. Communities are scattered. Health facilities are far apart. Many women travel for hours seeking emergency obstetric care.
Nimewahakikishia ya kwamba from now henceforth hii huduma itapatikana hapa Bura na tunapatiana kwa mama wetu. Hakutakuwa na cases ya maternal death hapa ama hata perinatal pia.
Can you make the ambulance very, very much functionable so that I'm not getting a patient who's been bagged from Tana River to Kilifi County? That's how many hours drive? 3 hours. So definitely, by the time that mother is getting to me, the brain is probably dead. The baby might probably not be alive.
As maternal and newborn deaths continue to burden Tana River County, Governor Dadho Godana says the county government is now prioritizing investment in specialized healthcare workers and strengthening the overall health system. The governor says plans are underway to improve emergency response services, medical infrastructure, and access to quality maternal healthcare in a bid to reduce preventable deaths among mothers and newborns. The county only has one gynecologist and one pediatrician serving the vast county.
We are looking forward to actually activating another theatre which is at the maternity. That will be a very big achievement.
As night falls over Bura Sub-County Hospital, exhausted medics finally step out of the theatre. Inside the maternity ward, a newborn sleeps peacefully beside his recovering mother, his first fight already behind him. Outside, his father holds on to hope, not just for his family, but for every mother in Tana River still waiting for a fighting chance at safe delivery. But on this night in Bura, one mother survived, one baby survived, and a theatre that had long fallen silent breathed back to life.
Every woman, every newborn, everywhere. Tunajua, tunaweza, na tunarekebisha, na ni wajibu zetu.
Eunice Umolo, KTN, Tana River County.
Renewed Malfix is now even